Everybody, Mariah's having a bad day. She's in room 20 in the ER here. We're going to do a brief neuro exam that's been identified by our neurologist as we've rolled out this teleneurology service. Basically, what we're accountable for, what they're asking us to be accountable to. I grabbed off the cart some reference sheets. This is an exam flow sheet. There is our cranial nerves related here and how to do them, and our reflexes. So I'm going to use this to do the exam. We're going to focus, this isn't the entire exam, we're going to focus on the cranial nerves and the reflexes. I encourage you guys to practice, ask us, and we can help. So we'll briefly go through this. Mariah, is it okay if I do a quick neuro exam on you?
Sure.
Okay, so we're going to start with visual fields. We don't have to memorize what cranial nerves. We want to keep in mind that it's nice to stand off to the side of the bed because the neurologist is looking at us like from this view that we're looking at now. So the head of the bed or the side, just keep your head still, Mariah. I'm going to hold. Can you tell me how many fingers?
2.
And I'm going to go to all
2.
4 fields, and she's going to tell
1.
you.
2.
Okay, perfect. We're familiar with the light. We can look for a perla. We know how to do that. Gaze, we're going to do lateral gaze, and we're going to have her follow that. We can also do up and down, okay, across the midline. Sensation. Q-tips are in my neuro box. You can touch her face if you want, or use a Q-tip. Mariah, can you tell me which side I'm touching?
Left. Right. Both.
And you can do sharp or soft if you want, depending on the side of the Q-tip, if that is a request. Facial expression, we might be familiar. Can you smile for me? Can you lift your eyebrows? Stick out your tongue, say ah, and shrug your shoulders. So that right there covers our main cranial nerves, believe it or not. And if they direct us beyond that, that's fine. That's what we're held for accountability on. Just a quick overview. Reflexes, the queen square, it's circular. They really ask us to learn and think about reflexes that aren't in our wheelhouse. So there's more reflexes, but they ask us to look at the bicep reflex, the patellar reflex, and the Achilles reflex. I'll just briefly demonstrate. So we're going to put our thumb for the brachial. We're going to go medial, really, and we're going to feel for that tendon. We take the queen square and kind of let the weight fall onto our thumb. We don't have to whack. Ooh, that's a good one. You're going to really feel it under your thumb if you get it right, or you can see the thumb or arm move. So we do one side, and then we may need to walk to the other side of the bed and do the other. We're looking for deficits on either side, so we don't go down one side, then the other. The patellar is a fun one. We want to support under the leg, have them relax, and we're going to let the hammer fall down onto that. Bam. Bam. So I'm going one side, the other. And if you can see it or feel it, and we communicate that. This one, the Achilles, we're going to hold. If you hold a little bit of tension on the foot, you can hit, and you can hold their foot up, just relax. You can hit on that and feel it kind of kick under their feet. It's hard from here. And you can communicate that. You can also just support and actually go underneath. But if you put your hand under, you can feel it. So those are actually the main assessments that they've asked us to look at. We'll come around and practice, but if you have any questions, we're here. Thank you.